Hello and thank you for watching this presentation. This is the presentation that was done back in April of 2023. I'm Daniel Amadi, now PharmD, and I'm going to go through the slides together for our presentation. So the presentation is about Mounjaro or tirzepatide, which is a GLP1, one of the agonist medication that is available, and it comes in three different doses: 5 milligram per 0.5 ml, 10 milligram per 0.5 ml, and 15 milligram per 0.5 ml. So you starting dose is 2.5 milligram for 4 weeks, once weekly, and then after the first month you go to 5 milligram once weekly for second month. If additional glycemic control is needed, then you can increase to 7.5 per week or 10 milligram per week, all the way up to 15 milligram per week. Mechanism of action and the effect of Mounjaro is a single peptide that activates GLP and GIP and GLP1 receptors. By doing that, increases insulin secretion from pancreatic beta cells, increase insulin sensitivity in the cells, and reduce glucagon levels. And also slows gastric emptying, which helps losing weight. Indication for Mounjaro is indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes. An important note here, Mounjaro is not indicated for use in patients with type 1 diabetes. In terms of storage and handling, Mounjaro is stored in refrigeration, 36 to 46 degrees Fahrenheit, or 2 degrees to 8 degrees of Celsius. If needed, each single dose pen can be stored unrefrigerated at the temperature not to exceed 86 degrees. Do not freeze Mounjaro. Do not use Mounjaro if frozen. Store Mounjaro in the original carton to protect from light. Some of the adverse effects of Mounjaro: risk of thyroid C-cell tumors, hypoglycemia with concomitant use of insulin secretagogues or insulin, example glipizide, pancreatitis, diabetic retinopathy complications. Inform patients to contact their healthcare provider if changes in vision are experienced during treatment with Mounjaro. Acute kidney injury. Actually, on that retinopathy, I have a patient who in my pharmacy complained that after using Ozempic, his eyesight got worse. So Ozempic is also another one of these group of drugs, GLP1 agonist. Advise patient to read FDA-approved patient label medication guide. In terms of pregnancy, it says use in pregnant women are insufficient. Evaluate for a drug-related risk of major birth defects, miscarriage, or other adverse maternal or fetal outcomes. There are risks to the mother and fetus associated with poorly controlled diabetes in pregnancy. So here it just talks about estimated background risk for major birth defect is 6 to 10% in women with pre-gestational diabetes with an hemoglobin A1C greater than 7%, and has been reported to be as high as 20-25% in women with A1C of greater than 10%.